Hello and welcome to the Purple Rose Project YouTube channel. This is quite new to us, so as we're getting used to this media, I thought that we could provide you with some video blogs. Now, on these first videos, I will actually read some written blogs that I have also already provided for the Purple Rose Project. And so bear with me if it is less animated than a normal video blog may be. I do hope that this will be helpful for you. I have written several articles, but I am actually choosing some subjects that I don't find are readily available, at least on video blogs. So hopefully this will be informational and give you something to reflect upon, and do not hesitate to ask questions or react to this video. So does therapy work? That's where I decided to start. Therapy. Does therapy work for couples involved in an abusive relationship? Does therapy work for abusers? A large number of domestic violence spouse victims will ask their partner to attend couples therapy. Now, whereas this is a normal and proactive response, actually a very good response to address issues in an intimate relationship, it's also an expression of and may reinforce one major reason why victims remain in abusive relationships. Victims often believe that they can fix the problem. Generally, if domestic violence is to be addressed by therapy, general professional consensus is that it should be done through separate individualized therapy. So couples therapy is designed to work on each person's role in a troubled relationship. Responsibility is shared. Yet domestic violence is the sole responsibility of the abuser. It does not matter what happens in a relationship. Nothing excuses abuse. At best, couples therapy may be a foot in the door for the victim, yet hopefully therapists in couples therapy will identify the domestic violence rapidly and immediately following decide to modify strategy and place the couple into separate and individualized care plans. Victims of domestic violence need access to support. They need access through the community, their own families, friends, or something more structured such as therapy. Therapy can help them enormously if it is individual, without the presence of the abuser in the room. Abuse results in desensitization in the victim. It results in their breakdown of self-esteem and their sense of self, actually. So much more. PTSD, for example, and or depression has been documented among 70% of domestic violence female victims. And the source of that is a national organization, NCADV. Victims' primary health needs cannot be met through couples therapy, not the objectives of normal couples therapy. If a domestic violence couple invests in this, abusers will manipulate the treatment process. They will. They will often manipulate therapy through token improvements, and they will also seek covert manners to transfer their control to this new environment. A victim, meanwhile, is placed in a very dangerous situation. If they discuss the abuse with the counselor, they are more likely to suffer more abuse when they get home. If they choose not to discuss the abuse, or if the shared responsibility deters from their ability to discuss the abuse in a frank manner, nothing can be accomplished. And it is another psychological control win for the abuser. In fact, when a victim is courageous enough in couples therapy to discuss the abuse, and if this is either discarded or downplayed by couples therapy dynamics, the therapist's encouragement to listen to the abuser and search for their own options to prevent the abuse, the resulting psychological impact is notable. This type of care plan may lead to prolonging the problem or even worsening it. Moreover, as much as psychologists seek neutrality, their work may be adversely affected themselves by the dynamics that are going on in domestic abuse. I think I want to interject here that in 1990s, there was a survey of several hundred therapists regarding domestic violence cases, and it revealed 41% failed to identify obvious evidence of violence. None of the therapists identified the lethality of the situation. Those who did identify domestic violence minimalized the severity, and 55% said they would not intervene. 14% said they would work on the couple's communication style. And whereas this survey was conducted over 20 years ago, the phenomenon remains a problem today. I might add here as well that psychologists are not mandatory reporters concerning adult abuse, domestic violence. So if and when the adult abuse is identified, therapists must often undergo an ethical decision. Now, this decision is whether or not to work further towards gaining the trust of the abuser in hopes to assist behavioral modification, or to play hardball and hold him or her responsible for their actions. Now, the very nature of a therapist's work is to seek assisting patients and clients. So they might feel that they could take a softer approach to gain the trust of the perpetrator so that the abuser does not reject therapy, believing that later on they would lead to a more hardball approach and help change behavior or what's going on within this couple. Yet, unless the patient is court-ordered to see them, and unless he or she has expressed sincere and determined desire to change, calling their bluffs will always mean risking that patient will reject their therapy and no longer return at any moment. And the therapist knows this. So applying a soft approach may lead in the long term to the therapist losing sight of the baseline problem at hand. The therapist can unknowingly become a part of the abuse, the dynamics. Their work may encourage the abuser's common use of a victim stance. Now, this is a complete characteristic of abusers. They often will claim that they are victims to things. The psychologist's work may even go so far as to provide further manipulation tools to the abuser to help keep the real victim under their control. The therapist can unknowingly become the abuser's enabler, and his or her care decisions may end up orchestrated by placing the abuser exactly where he or she seeks to be, which is in control, and this through using some underlying covert threat that they will leave therapy or punish the therapist. So what therapy does work for abusers? The treatment of choice for abusers used to be anger management classes. That may be appropriate treatment of choice for someone with chronic road rage, but it's not for someone who commits violence against an intimate partner or family member. Now, many victims of abuse and even the community on the whole still falsely hold on to the belief that domestic violence is all about anger management. It's not. Victims and therapists must ask themselves some questions. Here are a few. Does the intimate partner, does the abuser abuse others? Are they able to stop themselves while they're raging or physically assaulting? Do they have an on and off switch? In other words, do they do this when they're in public, or do they just wait until they're behind closed doors to abuse at all or to escalate? And if physical abuse is at hand, are traces of it often hidden? Are they able to be emotionally cruel just seconds before arriving somewhere or before someone shows up and then behave entirely differently? Does their abusive behavior constitute loss of control, or does it constitute bullying? If they do abuse emotionally or physically in public, are they able to stop immediately if someone else, a witness, shows up, or if they find themselves in a situation where they can look bad or get in serious trouble? If they do sometimes rage at others, do they lose it in all frustrating circumstances, or only with selected individuals, and not the ones where they would have strong interest in avoiding such behavior? For example, would they lose it with policemen? The logic behind putting abusers through anger management courses was that if they could just learn to recognize when they were getting angry and then counting to 10 using a punching ball, etc., then they could control their behavior. Yet over 20 years of sending abusers to anger management classes has provided clear results. They do not work in these cases. The issue regarding domestic violence is power and control. George Anderson, which is the founder of Anderson & Anderson, the world's largest provider of anger management counseling, once explained the offender is likely to beat or abuse the victim whether or not he or she is angry. Another misconception about domestic violence is that the abuse occurs as a result of alcoholism, drugs, or some unfortunate lifetime circumstance, unemployment, huge stressors, etc. And often victims will argue here, but it's true, he only becomes abusive when he's drunk. But it's true, it all began when he lost his job. This is not so clear. These factors may aggravate or coexist with domestic violence. However, they are not the cause to it. If a victim noticed something is triggered, they are probably not noticing that the partner is abusive in other circumstances as well, however, more subtly. Specialists who work solely with abusers have also noted that many abusers who will stop physical abuse, physical assault towards their partners, will often continue to psychologically abuse their partners. The core of the abuse is the issue that needs to be addressed. The only form of treatment today that research currently supports are better intervention programs, or as they call them, BIPS. BIPS attempts to address all levels of violence, including verbal abuse, emotional abuse, sexual abuse, physical abuse, or financial abuse. It's a 6-month-long series of classes, usually taught by licensed facilitators, and BIP classes present physical violence not as an isolated incidental behavior, instead a culmination of many abusive behaviors or tactics to gain power and control over another person. That's important to note, and I will repeat it once more. Abusive behavior equals tactics to gain power and control over another. BIPS, a type of therapy at that matter, we might add as well, unfortunately, are of little use to abusers that have personality disorders. Now we hear narcissism, psychopathy, sociopathy. Those are personality disorders. If one truly has a personality disorder, therapy does not work. And personality disordered population makes up 9% of our U.S. population, according to the NIMH in 2007. Of course, personality disorders are not solely narcissists and sociopaths. They are also borderline, etc. BIPS programs are useful to abusers who learned at an early age to respond to their frustrations through abusive behavior or fears. Please note here that learned behavior does not necessarily point to childhood abuse. Not all abusers come from abusive families, and not all children growing up in domestic violence households become abusers themselves. It does increase the risk. One abuser in a family, by the way, does not mean that all siblings are abusers. So that was it for the article I had written on therapy and domestic violence. I hope that you found it interesting and vital, important. Please do not hesitate to react or ask questions, and I will see you in our second video blog. Have a great day.